Health insurance in Japan for foreigners. Japanese health insurance option for experts and international citizens. From teaching English as a second language to working in the high sector, Japanese experts' skin is diverse and dynamic. We are you are just as likely to find an entry family relocating in their 40s to start new career as you are to see university students talking a year or two to work, save and travel happily. No matter what their career path, there are excellent options for health insurance in Japan for foreigners. Overview of Japan health insurance. Japan has had universal coverage since 1961 and foreigners can be a part of the system. Under the career health care system in Japan, 70% of the cost associated with medical appointments, hospital visits, tests and prescription for are billed to the government. Patients are responsible for the remaining 30%. In some circumstances largely dependent on income, the patient's share can be even less, either 20% and even 10%. The 70% which the government is responsible for paying is covered through income generated through two systems known as SHI and NHI. SHI or social health insurance is the program that all full-time employees of medium and large-sized companies are automatically enrolled in. Approximately 5% of their salary is held back as a health-based deduction. This amount is matched by the employer. Those who are self-employed or work for a small business contribute to the National Health Insurance Program or NHI. Their actual contribution varies by income and the process is a bit more arduous compared to the SHI. Residents are required to complete their paperwork at one of 47 region administrative districts. Global health insurance in Japan for foreigners. We have selected some of our most popular private health insurance plans and are providing them to you, guide you in your search for medical insurance in Japan. The following providers are of the highest quality for product design and customer service. We stand behind these medical insurance companies and are available to of all of our clients to support you during the entry entirety of your terms with the medical insurance plans you choose. Best Japanese health insurance for foreigners in Japan. The Cigna Global plan is available to all experts and international citizens living in Japan. It is comprehensive, offer a range of coverage and pricing options, and have excellent service. Click on the link below to learn more about the many options available with Cigna Global. Request a quite today to get pricing and cost information. Best health insurance for Africans in Japan. US citizens or expert living in Japan may not want a specific plan that is tailored to their specific needs. The GeoBlue Explorer plan provides high quality benefits, premium service and a variety of options allowing you to tailor coverage to your specific needs. The plan provides up to 9th month of coverage in the USA. Is your compared to other plans that will limit coverage in the US to 3 or 6 months per year. Finally, if you do not care back in the USA, you have access to the Blue Cross Blue Slide network of hospital and doctors. Outside of the USA, the Explorer plan provides a premium network of doctors and hospitals, so you can be assured of access to quality care anywhere in the world. Cost of health insurance in Japan for foreigners. The cost of health insurance in Japan will vary depending on many factors, primarily your age, the level of cover you desire, and the plan of you choose. The cost for a 45 years old single man with a Cigna Global plan range for $2,000 to $5,000 per month, depending on the benefits you choose and your country of nationality. How expert in Japan can quality for local Japanese health insurance coverage. Foreign residents who intend to reside in Japan for 3 months or longer can join NHI. This applies even to those who are working for the medium and large size companies associate with the SHI program. SHI requires 1 year to come into effect. Those is in the beginning it's an SI for nearly everyone. However, until your applicants in completed and approved, you are on your one for health insurance cost and should carry your one insurance. Overall, SHI more economical than NHI. The cost of SHI is split between employee and cost of and employers. Furthermore, SHI includes coverage for family members. NHI does not. Therefore, if one family member is working and covered by NHI, the remaining family members will need to apply on their own, as will unemployed people are required to register with NHI. Expert moving to Japan to teach English as a second language should not note that some less than scrupulous companies and only allow employees to long 29.5 working hours a week. That's because you must work 30 hours a week to be residents full time and eligible for SHI. This is their snaky way of making sure that do not have to pay the employer's share of SHI. If teaching ESL is in your future, speak with other teachers to join inquire how their company handles NHI and SHI. Make sure that you read the fine print on your contract to determine how to company defines full time and if it is in line with the NHSI definition. What you need to know about process. Within 2 weeks of moving to Japan, you are required to enroll in a health insurance plan. However, required is a tricky word while needs like required and mandatory are often used in official documents. You contact be deported or have your visa renewals denied because you have not enrolled. There are no penalties if you don't enroll, but you should. Overall, it's a very smart plan to do so. The cost is fair and the coverage is excellent. However, if you have an alternative arrangement already is place which cover your health insurance cost, you will want to look into just how required uh, enrollment actually is with your employers. Applying for an ASI is a cost of visiting your local wards for city office with your shopping documents, passport, visa confirmation of employment, and proof of income for the previous year. When you receive your health insurance card, don't let it go. Without it, you will have to pay for 100% of your medical cost. You upfront interest of the usual 30%. You will actually be reimbursed, but it's a hassle you rather avoid. While it's not part of the regular NHI and SHI paperwork, there is one important form that all experts should know about. It's called a Wakan Shawmei certificate. This will allow you to largely import a year supply of prescription Japan prescription medication if no recombinant drug is available in Japan. It's commonly used by experts to access their preferred contraceptive medication. Pros and cons of using the Japan health insurance system. Experts will really on the public system for nearly all their primary care needs. This because by law all hospitals in Japan must be not for profit. All clinics must be owned and operated by physicians. Their limited provide system in promotionality focus on elective and cosmetic products. Overall, the Japanese healthcare system offer an excellent understanding of public healthcare. There is a long emphasis on preventative care, including vaccinations programs, prevention care, and critical license prevention. However, if the system has one weak point in is mental health, receiving mental health care and treatment is still stigmatized. Furthermore, Many treatments and products long considered out of date in other countries, such as the use of isolation and rested remain relatively commonplace in Japan. One thing which many experts want be expecting in that in Japan patients communication might be very different than it is at home. Doctors have significant authority questioning your doctor's order and interactions or even asking for further expansions or certifications in rarely done. Rules are revised. The concept of a patient's right to know is not commonplace. This can make using the local healthcare system even more stable than it needs to be. It helps in part to speak with other experts to know that to expect or to have a trusted for friend or college with you more for more moral support. In Japan, nearly everyone carries supplemental provide health care insurance. This coverage augments the coverage cost that patients are normally responsible for the 30% of the cost associated with medical visits and so on. This saving alone can add up quickly. It can also offer from provide nations option as well as things that aren't normally included in the public system such as authorities. Hot to know when considering health insurance in Japan. Why there are visiting Japan as a traveler or a long-term expert, language barriers are a significant problem for everyone accessing the Japanese health system. Not all physicians and nurses speak English. Even experts who can speak conversation Japanese and may find medical term, terminology a college. Choosing a supplemental insurance plan which include an excellent support program in key. The step can help you contact with English speaking medical personnel. They can also arrange for hospital stay at familiar facilities. You can also inquire inquire about packages that include provisions for support step during a medical emergency like home care assistance or even predators. While countries have a look of physicians in areas, the option is true in Japan. Urban areas are strongly linked to retain their physicians. Doctor favor rules areas for a less stressful life. While this does not mean there are no more doctors in major cities, it does mean that wait time might be longer. Hospital wait times are a problem in large cities, and hospitals have even been known to turn away patients in critical care when their beds are at capacity. This is another situation in which an insurance plan with a strong focus on customer support can make into play. How to find a family physician while in Japan? In Japan, families physician and general practitioners are far less common than they are in other countries. The major of physicians go on to practice a specialty, and patients can make appointment directly with a specialist. Japan Healthcare Info is an organization that offer free healthcare related service to experts. They can recommend a specialist interpretation service and offer general advice. They are a good first connection if you want to find a family physician. How routine doctors visit work in Japan? It may feel very strange to go to the hospital when you are just moderately ill. After all, however, unless you have a family doctor or you are certain about the kind of specialist you need to see, going to the hospital is a reasonable first step. Hospitals in Japan are used far more often for non-emergencies than in another countries. The step can arrange for you to have your routine follow-up appointments at an appropriate clinic that specialize in your concerns. Before you have home, make sure you have your Japan health insurance care with you. Vaccines requirement required for entry into Japan. As advised by the CDC, make sure you are up to date on routine vaccines before very every tips. These vaccine include measles, measles, mumps, rubella, MMR vaccine, diphtheria, tetanus, pertussis vaccine, varicella, chickenpox vaccine, polio vaccine, and your yearly flu shot. Hepatitis A and B are also recommended vaccine. If you do not already have them, you may need the vaccine for Japanese infectionitis for longer trips, more than a month for travel in certain prefecture, essentially rules areas, and depending on the time of your year. Finally, rabies in patients in the countries who consider a rabies shoot. If you will be traveling to remote area, spending time outdoors or in area with large bird population, as always we recommend you talk with your doctors or a local travel clinic before traveling to Japan. Be sure to have your annual flu shot too. Japanese emergency service in the event you need to access your service. Access emergency service. Call the following: 110 for police, 119 for fire and ambulance. Be aware that there may not be any that English speaking dispatcher available. Source: Japan Tourism. Travel insurance and safety tips for visitors to Japan. One of the most amazing and beautiful countries in in the world. Japan is an exciting and flung destination for most global travelers, from the stunning Mount Fuji to the bustling from the city of Tokyo or the Zen-like feel in Tokyo. The country is high-tech and modern, with respect and honors of its part. Japan is a large modern city country and is also very safe for visitor. While medical and in your good in Japan, it may be as challenging to access international doctors while aboard additional clinics or hospital that cater to US style expectational are costly, and there are not many pursuing travel insurance for Japan who will ensure you have access to international doctors 24/7 Travel Association assistance service and their benefits, so you can focus on enjoying your trip. When you travel to Japan, expect to experience fantastic food, see stunning temples and shrines, and enjoy a culture steeped, steeped in a long rich history. Through an expensive country to visit, a trip to the land of the rising sun can be a trip of a lifetime. It is a very stable country. It is a successful democracy and has a large economic. Throughout the country, tourist facilities are widely available except in some association area of the nearest. Below we offer about on how to stay safe when visiting and home of the better travel insurance for visitors to Japan. Is it safe to travel to Japan? People often ask it is safe to travel to Japan. Overall, the crime rate is below that of the national average in the US and other developed countries, and violent crime in rare. Crimes reported by travelers typically involve personal dispute, theft, or vandalism. Staying safe while traveling there includes constantly practicing and good personal security and using common sense. That include being respectful of local customs and etiquette and belong aware of your surrounding. Tips to stay safe include: be aware of potential pickpocket in crowded areas such as on trips at airport or shopping near. Keep your passport in your pocket. Stay when from counters, feet, or parted goods, no matter how accessible they are. They were eligible illegal in the US and purchase form of then may also be breaking local laws. High risk crime areas include some of the entertainment and nightlife districts in Tokyo, such as Roppongi, Kabuki, Chu, Shibuya, and Ikebukuro. Exquisite caution in the areas. passports and visa recommends for travel to Japan. To travel to Japan, a valid passport and a return tickets are requirement for visa fee. Tourist step of up to 19 days. All foreign nationals entering the country are required to be photography by the part of entry and to provide fingerprint skin. This is in addition to any other visa or passport requirements. Wallace citizens entering through customs and to ensure that their passports and visa are valid and up to date before departure. Many Asian countries required your passport to be valid for at least 6 months after you enter the country. International airlines will deny your boarding if you lack sufficient travel documents or passport. Your passport is not valid for 6 months. Do US citizens need a visa to visit Japan? The short answer is no. Visa requirements for us citizens are very relaxed due to the nature of US Japan realization for travel of 19 days. Visiting from the following countries are not required to have a visa: Andorra, Argentina, Australia, Bahamas, Barbados, Beijing, Bulgaria, Canada, Chinese, Costa Rica, Cyprus, Chinese Republic, Denmark, Dominican Republic, EI, Salvador, Estonia, Finland, former Jungsalp, Republic of Macedonia, France, Germany, Greece, Guatemala, Honduras, Hong Kong, Hungary, Iceland, Ireland, Israel, Italy, Latvia, Lesotho, Lithuania, Luxembourg, Mexico, Malaysia, Malta, Mauritius, Mexico, Monaco, Netherlands, New Zealand, Norway, Poland, Portugal, Republic of Korea, Romania, San Marino, Serbia, Singapore, Slovenia, Spain, Suriname, Sweden, Switzerland, Taiwan, Tunisia, Turkey, United Kingdom, the United States and Uruguay. Japanese health travel insurance from plans for visitors. Us as plan our trip, take advice of the opportunity of the purchase travel insurance as that you can be prepared for any unforeseen unforeseen and unwanted events. Below we will recommend a few different types of plans and some specific products that are recommended for travels to Japan. Insurance for trips to Japan. If you have booked a trip and are connected with having to cancel, you should buy Japan trip insurance coverage. Trip cancellation insurance plans cover the cost of your trip you have to cancel. There is typically a loss of by a cancel for any reason. Trip insurance plan that will reimburse you if you simply decide not to travel. 7 Carriers offer a couple of respected trip cancellation plans for travelers. The first round trip choose is for us citizens traveling abroad. The second is available to any other tropically traveling abroad. Health insurance in Japan. A recap: if you are moving the Japan as just visiting, the proper health insurance plan will provide peace of mind, access to the best medical care, and allow you to focus on making the most of your adventure. We hope you have found this information helpful. If so, please share with your contact and friends. In the meantime, use this link to request a quote today, and our expert agents will provide you with cost options and information on the best health insurance in Japan for your specific needs.